the Universitätsklinikum Erlangen, where new chapters in the history of German medicine have been written. One of the first kidney transplants in Germany took place here in 1966. The first test tube baby in Germany was born here in 1982. In 2004, the world's first MEG-controlled brain operation for epilepsy was performed. And in 2009, a cornea with endothelium was transplanted for the first time. Today, this is a routine operation. These are just a few of the headlines from Erlangen. Since the foundation of the Friedrich-Alexander-University of Erlangen-Nuremberg in 1743, the medical faculty and the university hospital have achieved pioneering successes time and again. Erlangen researchers continue to set new standards in medical prevention, diagnosis and treatment, and they provide the very highest standard of healthcare.
Das Universitätsklinikum Erlangen.
Unquestionably, Universitätsklinikum Erlangen offers top-class medicine. We provide a wide range of treatments of the highest standard for our patients. Here at the hospital, we really benefit from our proximity to the university. Our medical faculty carries out patient-centered research and is designed so that research results can be applied to our patients' treatments as quickly as possible. In other words, we do not carry out ivory tower research. Our research successes lead to treatment benefits for patients.
Sondern Forschungserfolge sind Behandlungserfolge beim Kranken.
Patient treatment and care of the highest quality, as well as research and teaching at the highest level, are all linked together here. With around 50 clinics, departments and institutes, the Universitätsklinikum Erlangen encompasses all areas of modern medicine.
In the event of an emergency, every second counts. The Universitätsklinikum Erlangen provides decisive and life-saving emergency treatment. This is particularly important in the event of a stroke.
Now, open your mouth and stick out your tongue.
The sooner medical treatment is provided, the better chance the patient has of surviving the stroke without suffering lasting damage. In the stroke unit at the Universitätsklinikum Erlangen, the neurospecialists work in close cooperation, thus guaranteeing the best possible treatment in the event of a stroke. In order to avoid brain damage, the patient should be treated within 2 hours. Here, in one of the largest stroke centers in Germany, it only takes 15 minutes for treatment to be started. The expertise of the Erlangen stroke specialists also benefits many hospitals and medical centers in the Nuremberg metropolitan region. They are connected by video link to the Erlangen stroke unit, which provides them with round-the-clock telemedical advice. Decisive advances in emergency treatment are achieved primarily thanks to state-of-the-art devices. For strokes, cancer or cardiovascular diseases, modern imaging processes enable quick and accurate diagnoses. Thanks to the quickest CT in the world, images are produced in fractions of a second. A magnetic resonance tomograph with a magnetic field strength of 3 Tesla also makes even the smallest vascular damage visible. Using biplanar angiography, pathological changes even to the smallest cerebral blood vessels can be identified and treated in a minimally invasive way via the groin. Keyhole operations are a core element of neuroradiology and neurosurgery at the Universitätsklinikum Erlangen. With the high-tech devices at our disposal here, completely new treatment procedures are possible. They also mean that emergency patients can be treated more quickly and effectively here than anywhere else. State-of-the-art technology and top-class experts, an unbeatable team.
Die Notfallversorgung in der Kopfklinik in
The emergency treatment at our clinics in Erlangen is truly outstanding. The various areas of neuro-expertise, neurology, neurosurgery and neuroradiology work in close cooperation. We work efficiently and discuss each patient individually so we can provide the best treatment for each of them. Another great advantage is that we have state-of-the-art devices available on site. Patients can be given a high standard of examination at any time, and that is something that really pays for itself.
was sich bezahlt macht.
Here is an example. In the most advanced operating theatre in the world, brain surgery can be performed with unprecedented precision thanks to neuronavigation with intraoperative MRI. Epilepsy lesions can be shown by the surgical microscope and removed with precision by the neurosurgeon. This means that functionally important regions of the brain are not put at risk. This is a milestone in epilepsy treatment.
The Universitätsklinikum also does pioneering work in the area of education. New teaching and learning methods have just one purpose: acquiring knowledge. Interactive communication systems facilitate learning and motivate medical students to act responsibly from the very beginning.
That is what you must be able to do as a doctor.
Using interactive learning programs, students can deal with virtual practice cases across the entire medical spectrum. So now we do the heart massage. In this way, complex knowledge can constantly be expanded, which helps later with the everyday medical routine. Learning by doing is the motto at the medical faculty. Training on life-size simulators is a future-orientated approach. Students can practice various emergency and anesthesia scenarios on dummies in a process of trial and error. These dummies simulate a range of physical reactions, which are produced by computers. The Universitätsklinikum Erlangen is also a pioneer in the field of new study courses. Students have been able to study dental implantology since 2009. This is only available at Erlangen. This is an absolute first in German university medicine.
The heart is the engine of life. Unhealthy hearts are given the best treatment here, thanks to our top-class specialist and high-tech treatment. At the Universitätsklinikum Erlangen, we excel in the provision of artificial heart implants for both children and for adults. This is often a patient's only chance of survival before a heart transplant can be performed. Erlangen is one of the most experienced transplant centers in Germany and fulfills international quality standards. Various specialist disciplines and highly qualified medical experts work together to ensure top-quality organ transplants. At the Academic Heart Center, cardiac surgeons, cardiologists, pediatric heart surgeons and pediatric cardiologists all work together. The Heart Center provides high-tech medicine. Malignant heart diseases and cardiac insufficiencies are identified in milliseconds using CT. Non-invasive coronary angiography produces results with comparable speed and is also kind to patients. Minimally invasive aortic valve replacement is performed on beating hearts in the Cardiac Catheterization Laboratory at the Universitätsklinikum Erlangen. Its cardiac experts are among the pioneers of this new procedure and set new standards with their innovative diagnosis and treatment.
I
believe we can honestly say that here at the Erlangen Heart Center, we can provide top-quality treatment to patients with any kind of cardiovascular disease. So when a patient suffering a heart attack comes to us, he will be treated as part of our chest pain unit program, 7 days a week, 24 hours a day. We can catheterize the patient, treat him in the intensive care station, and provide the patient with the best possible care in close cooperation with other experts. Heart transplants, and indeed any organ transplants, are high-level medicine and often the last chance to save a life. The Universitätsklinikum Erlangen is a leader in this field. As well as hearts, livers, pancreases and above all kidneys are transplanted. Moreover, kidneys from living donors are increasingly being used in Erlangen. Thanks to state-of-the-art procedures, this kind of transplant is possible even if the donor and the recipient have different blood groups.
Since the
mid-1960s, more than 3,000 organs have been transplanted here at Erlangen. Hearts, livers, pancreases and kidneys, with kidneys obviously representing the largest proportion. We can perform around 100 kidney transplants every year here in Erlangen. A quarter of transplanted kidneys now come from living donors. In the light of the shortage of organs, this form of transplant has a very special role, and we are glad that, thanks to our progress in recent years, we're able to carry out this kind of transplant across blood group boundaries. As well as bone marrow transplants, we even perform umbilical cord blood stem cell transplants, both on children and on adults. This is a good alternative if no bone marrow donor is available.
Erlangen research results are respected both nationally and internationally. Here, research means progress. The medical faculty concentrates on the following key areas of research: infection and immunology, the kidneys, circulation, neuroscience, pain and tumours. These key areas of research are also defined by interdisciplinary research groups. Universitätsklinikum can often provide new procedures and treatments which are not yet available anywhere else. One example from regenerative medicine is tissue engineering. Cells from the patient are cultivated in the laboratory together with the smallest blood vessels, and then the replacement tissue is implanted. No additional tissue extraction is necessary. Our researchers are also targeting skin cancer. They're working on the vaccination of melanoma patients with their own cells. The dendritic cells initiate the destruction of cancer cells by the immune system. This procedure is also used for other tumour types. In the GMP laboratory of the hospital pharmacy, cytostatic solutions tailored for each individual cancer patient are produced in high purity conditions. The laboratory meets the highest possible international quality standards for the production of medications. The effectiveness of new cancer medication is tested in clinical studies. Hence, the GMP laboratory at the pharmacy provides excellent support for clinical research procedures. It also provides research institutions with special preparations for cell cultures, for example. Research and patient treatment go hand in hand in Erlangen. Their motto: knowledge leads to healing.
With the best treatments for cancer that science can currently provide, the Universitätsklinikum Erlangen is a leader in the fight against cancer. With the latest diagnostic procedures, oncologists in Erlangen are hot on cancer's trail. Thanks to confocal endoscopy, the patient suffers minimal discomfort during the investigation of tissues. A laser endoscope can be used to examine suspicious cells at 1,000 times magnification. In addition, chromoendoscopy uses various colors of light to achieve a magnification effect. Tissue is extracted and tested only if the tissue examination gives grounds for suspicion. The University Cancer Center Erlangen, the cancer center of the Universitätsklinikum Erlangen, was named as the leading cancer center by German Cancer Aid in 2009. The oncologists who work here are highly respected throughout Germany. In the regular tumor conferences, every single case of disease is discussed intensively by specialists from different areas of expertise. This close cooperation produces an individual treatment plan for each patient. We are one of only 11 leading centers with funding in Germany. This gives our patients the assurance that they will really receive the best treatment for their tumors. Ultimately, we were awarded this distinction because a whole series of internationally respected studies was carried out at our hospital and indeed led to a treatment paradigm shift. Our oncology center's excellent reputation as a leader in the field is further enhanced by one of the most advanced radiology clinics in Europe, with state-of-the-art procedures such as stereotactical radiation treatment and brachytherapy. Tumors of any size can be targeted and destroyed. The benefit of this is that tumors are considerably reduced in size and there are only very minor side effects. At the Universitätsklinikum Erlangen, leukemia patients can be treated using blood from the umbilical cord. Ours is one of only 3 centers in Germany authorized to produce stem cell preparations using donated umbilical cord blood.
Caring for people is our motivation. At the Universitätsklinikum Erlangen, patients not only receive care, they receive expertise with a heart. Around 2,500 nursing and auxiliary employees care for patients every day. They constitute the largest employee group in our hospital, and they tend to all the patients' needs, whether major or minor, around the clock. The patient's health is of paramount importance to them. There is a wide range of further and advanced training on offer because the quality of patient care should always meet the highest possible standards. The hospital's own Academy for Health and Care Professions provides a comprehensive training program for the nursing service employees. This helps to ensure that the hospital's nursing staff is highly qualified. The nursing teams at the Universitätsklinikum are not only dedicated to providing a professional level of care, it's also of paramount importance to them to care for each patient individually and to establish close relationships with patients.
The Universitätsklinikum Erlangen. It is the flagship in the Medical Valley Excellence Network of the European Metropolitan Region of Nuremberg, and it's helped to ensure that this region has been named as one of the leading regions for medical technology. It is a role model for other hospitals.